All. This is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. So today we'll discuss a Norwegian study where they have been looking at unexpected vaginal bleeding in non-menstruating women who had mRNA COVID vaccines. So the general summary is that there is an increased risk of many folds, anywhere from 2 times to 5 times compared to non-vaccinated. So very, very interesting. And in some cases, about 30% of the post-menopausal women had to seek medical advice when this unexpected vaginal bleeding occurred after the vaccine. And they also observed that this happened more after the second dose. So let's look at it. So these are the references. This is DrBeen.com. In the description of this video, there is a link that would get you access to DrBeen.com's medical lectures at a very inexpensive rate. So take advantage of that. Then this is the study that we're talking about: unexpected vaginal bleeding and COVID-19 vaccination in non-menstruating women. And if you see here, the authors and the researchers are from Department of Method Development and Analytics, Norwegian Institute of Public Health, Oslo, Norway. Then I wanted to add a few of the mainstream or some stream news coverage as well. And there are many, so that you can, if you just wanted to listen to or read in a more abstract level what they're talking about, then you can read these. All of these links are in the description of this video. This is the same thing in Yahoo. This is that study's PDF. Then there are some references as well for various definitions of the terms that we will use in this discussion. And then here is the studies PDF, and yours truly has been going over this, as is the case usually, and learning and highlighting for you. So now let's start it with my diagrams. So these are gifts for humanity. Today's gift is for adult humans, and let's see what we're talking about. So here is a summary of this study. Norwegian Institute of Public Health, study of non-menstruating women. So that could include women who were on hormonal contraception, women who are perimenopausal, that means they are near the age of menopause, and they have irregularities in their bleedings, and then post-menopausal or menopausal women who have had their bleedings stopped. This study is not about menstruating women, although I am a little concerned that those women who were premenopausal in this study here, premenopausal were those who were taking contraceptives, especially the 74% of them had hormonal IUDs, and they had a similar level of unexpected vaginal bleeding. The size, and these are all self-reported, this is a retrospective study. The sizes of the population are interesting. So they had the three main groups. One was postmenopausal, 7,724. Other group was perimenopausal, that was around the age of menopause, 7,148. And then there were premenopausal, that were in the normal menstrual cycle age or reproductive age, but the women that were included here were those who were not menstruating because they were using contraceptives. Any women who had hysterectomy, they were excluded. Anyone who was pregnant, they were excluded. Anyone who had other reasons for bleeding that had stopped, they were excluded. So here is what they found. They found that women who had mRNA vaccine, 3.3% of the post-menopausal, 3.3%. So these are those women who didn't have the bleeding. The age, if you look at it, 66 to 81 years of age. They didn't have the bleeding, and they had 3.3% of them had unexpected vaginal bleeding. 14.1% of perimenopausal that were about to become menopausal, they had unexpected vaginal bleeding, and 13.1% of premenopausal had unexpected vaginal bleeding. Of course, then you would have a question in your mind that what is the incidence in non-vaccinated? So if I didn't have vaccine, what was the chance of me, if I'm a woman, having unexpected vaginal bleeding? So they have those ratios looked at as well. So here, the other thing is that is interesting, that anywhere from within 4 weeks of the vaccine dose to up to 8 to 9 months of the vaccination. So the coverage time of the effect of the vaccine in terms of causing unexpected bleeding went up to 8 to 9 months. And another thing I want to say that first, the mechanism, and I'll show it to you near the end of this talk, they wrote that they suspect that mechanism is not hormonal, that it is not hypothalamo, hypophyseal, or pituitary axis abnormality. It is not that. They think it is something to do with the spike protein affecting the endometrium or the uterine layers, causing the bleeding. So this was actually interesting for me to observe. If you say that right next to the vaccine dose there is a bleeding, you could say that there is an inflammatory state. But yes, there was higher incidence within 4 weeks of the vaccination, but this higher risk continued for 8 to 9 months. In the post-menopausal women, so 61 to 88 years of age, after getting the vaccine, within 4 weeks, so from the vaccine to 4 weeks, the risk or the increased risk of the unexpected vaginal bleeding was 2 times to 3 times compared to them when they were not vaccinated. 2 to 3 times increased bleeding risk within 4 weeks of the vaccination. And yes, so I just read a comment that it looks like it hurts her. Actually, there was an increased incidence of the menstrual symptoms as well. So even if there were some women who did not have the vaginal bleeding, there still were women that had the symptoms of menstruation, so cramps in the lower abdomen and pains and so on. Now, perimenopausal, that is the one who are not fully menopaused yet, and premenopausal, that are in reproductive age but have been using IUDs, hormonal IUDs, not just the mechanical ones. The hormonal IUDs are mechanical IUDs with a small amount of hormones released on there over years. So perimenopausal and premenopausal women, they had within 4 weeks of vaccination, they had 3 to 5 times increased risk. 3 to 5 times. It's not 3 to 5%. 3 to 5 times increased risk of unexpected vaginal bleeding. Now, this is also very interesting that premenopausal women, premenopausal, that is reproductive age women on hormonal IUDs, these women who took Moderna or Spikevax, they had 32% increase. So this is not folds, this is percent. 32% increased risk of unexpected vaginal bleeding compared to community, which is Pfizer-BioNTech. So Moderna caused more of the unexpected vaginal bleedings compared to Pfizer. So, with this summary, the abstract, I wanted you to read it. The association between coronavirus disease, vaccination, and vaginal bleeding among non menstruating women is not well studied. The Norwegian Institute of Public Health followed several cohorts throughout the pandemic and early performed a systematic data collection of self reported unexpected vaginal bleedings in non menstruating women among 7,725 postmenopausal women, 7,148 perimenopausal women, and 7,052 premenopausal women, 3.3 times, 3.3%, 14.1%, and 13.1% experience unexpected vaginal bleeding during a period of 8 to 9 months, respectively. In postmenopausal women, the risk of unexpected vaginal bleeding, so postmenopausal, that is postmenopausal bleeding in the 4 weeks after COVID-19 vaccination was increased 2 to 3 folds compared to pre-vaccinated period. The corresponding risk of unexpected vaginal bleeding after vaccination was increased 3 to 5 fold in both non-menstruating peri and pre-menopausal women. In the premenopausal women, spike vax was associated with at 32% increased risk as compared to community. Our results must be confirmed in future studies. Now, some details. So, this is my drawing of a hand. It almost looks like a hybrid between a hand and a foot. So, probably made by AI. So, details. Number one, European Medical Agency has asked to place a label on the mRNA vaccines for the increased risk of heavy menstrual bleeding. All cohorts that participated in this study, they described menstruation as heavy compared to pre-vaccine periods. So all of them, regardless of their age, they all said that our menstruation has become heavy. Perimenopausal women, so around the menopause, reported the longest duration of bleeding. So not only it is the heavy bleeding, but there is also a longer duration of bleeding. Then seeking medical help, ending up going to a doctor saying what is going on. So post menopausal, 30.6% of the women had to go to hospitals or doctors to say, I have this problem. Perimenopausal, 13.8% went to the doctors. And premenopausal, 9.3% went to the doctors. Now, please remember, premenopausal are those in this study, they were those who were in the reproductive age, who were healthy to have menstrual periods, but they were on hormonal IUDs. So ideally, they were not supposed to have the menstruation, and they had breakthrough bleedings. So then pre-vaccination. So this is before the vaccination. Pre-vaccination rates. So remember I had said that there is going to be a question in your mind that what is the rate in general? So this is that. Pre-vaccination rates of unexpected vaginal bleeding in post, peri, and pre-menopausal women were 4, 13.4, and 11.5 per 100 person years. Compared to before vaccination, age-adjusted hazard ratio after the first and second dose in postmenopausal women were 3 and 2.2. So after the first and second dose, the times, this is 3 times is the hazard ratio, 3 times and 2.2 times after first and second dose. Then 3 and 2.2 for, where was I? Hold on. Compared to the before vaccination age ratio of the first and second dose in postmenopausal women were 3 and 2.2. In perimenopausal women, the same ratio was 4.2 times and 3.7 times after first and second doses. And in premenopausal women, it was 4.7 times and 4.2 times. So that's interesting that it was such a higher incidence. Both, so in all groups of women, rates were higher in hormone replacement therapy users and women with hormonal IUDs as compared to women not using hormones. And we can understand that when somebody is taking hormone replacement therapy or when they are using IUD that is hormonal, that would cause the uterus to have a little bit of decidua developed. Decidua is that specialized layer of the uterus that is developed to receive a zygote or a fertilized egg that would then develop into a baby. So those layers are then easy to be broken off and then bleeding can occur. So all those women who were on hormone replacement therapies, they had a higher incidence of the breakthrough bleeding. In perimenopausal women, the hazard ratio was higher in non-hormone users as compared to women using hormone. So that is interesting. I have been thinking about this because they don't explain the mechanism. And of course, gynecologists and obs or gynae obs, they know better what should be the mechanism. My thinking is that the perimenopausal women, they have an abnormality in their layers that are developing because of the hormonal abnormalities that they are developing. So when the hormonal replacement is given, they possibly has a more symmetrical endometrium develop or decidua develop compared to non-hormonal replacement therapy users who may have more abnormal structures while they're going through this perimenopausal time. So those irregular structures may be more prone to become shed compared to those that were more regular. So that's just my thought. I may be completely wrong here. 74% of premenopausal, I keep saying it, the ones in the reproductive age, but on the hormonal contraceptives, 74% of premenopausal women had hormonal IUDs in this study. But they say over here that even when they thought that because of the hormonal replacement, the decidualization or development of that extra spongy tissue within the uterus, plus more immune cells to be present in the tissue, which is going to become decidua, even regardless of that, it seemed like the unexpected bleedings incidence was uniform across the cohorts. So here, most non-menstruating premenopausal women in our study had a hormonal IUD, 74%. Thus, the overall estimate for the premenopausal group reflect women with such device. Common endometrial changes in these women are glandular atrophy and stromal decidualization. So their stomach has a little more spongy layer. I'm using spongy more freely. There are actually multiple layers and they all have different names, but let's just call it decidualization. So they have more of that developed in addition to foreign body reaction. So because there is an IUD sitting in there, plus increased inflammatory cells. They said because of all of that, it is possible that they may have had more bleeding tendency compared to the other. However, despite the physiological changes, we did not detect clear difference in the relative risk of bleeding across hormones used in premenopausal women. So that was interesting. Premenopausal women did not have much effect of hormone use or not. And finally, I think this is a very interesting set of paragraphs to look at. I'm going to show these to you as well in the study. So if you continue to go through the study, and then you arrive near the end of it here, these are the two paragraphs I want to go through with them. And then soon after these two paragraphs, there are strengths and limitations of the study. So I would request you to please read them by yourself. Of course, one of the limitation is it's a retrospective study, and another limitation is it is a self-reported study, so there can be a recall bias and so on. So here, in all three groups, the association between vaccination and bleeding tendency to be slightly stronger in women without gynecological conditions as compared to women with such history. Without gynecological condition mean that these women must have a normal, healthy endometrium. And the vaccine's effect caused that to bleed because it is geared up to bleed normally. So if there is no zygote. Yet, as the rates were generally higher among women with any gynecological condition, the absolute excess risk posted by vaccination was greater among women with these conditions. So absolute rates were greater in women with conditions, but otherwise, when they stratified it, it was in healthy women. Our findings indicate that the COVID-19 vaccine or the host response to them. So here they're talking the mechanism. This is why I brought it here. They're going to talk about, is it the hormonal abnormality because of the vaccine, or is it a uterine mechanism? It may actually be both. So this is their speculation. Our findings indicate that the COVID-19 vaccine or the host response to them can lead to vaginal bleeding in a wide range of women. Host response mean our immune system's reaction. Unexpected vaginal bleeding in post, peri, and pre-menopausal women greatly have different underlying causes. Generally have different, which is fine. However, our findings of an increased risk across the reproductive stage raise the possibility that the mechanism linking COVID-19 vaccination to unexpected vaginal bleeding may be similar across the stages. So they're saying that there are women in the study of various stages of reproductive age. So that means their endometrium or their uterus is in various stages of its being. But vaccines had similar effects on all of them. So it does not look like something to do with the hormones. Otherwise, in postmenopausal women, they would not have the similar outcomes as premenopausal women. So it looks like vaccine is directly doing something to endometrium instead of playing with the hormones. Although our data are not fit to explore biological mechanisms, so they're raising their hands and saying, we do not have data to actually say what is the mechanism. Although our data are not fit to explore biological mechanisms, the increased risk after vaccination across different stages of reproductive aging, post, peri, and pre, and exogenous hormones use may suggest that the mechanism is not through disruption of hypothalamic pituitary ovarian axis. So it's not hormonal related, because if that was the case, then the reproductive age women will have a higher incidence, but they saw all age women to have the same incidence, almost similar incidence, I should say. Increased risk after both Comirnaty and Spikevax suggest a mechanism related to the severe acute respiratory syndrome coronavirus 2 spike protein and not to the vaccine other components. So what they're saying is that there are other components within the vaccine. There are adjuvants. If it was the adjuvant, then one vaccine may have been doing it and the other one not. But they both are doing it. Then the common thing between them is the spike itself. So they say because of that, it seems like it is spike that is doing it. This is also supported by a higher risk observed by Spikevax in premenopausal women. An increased risk of PMB diagnosis after SARS-CoV-2 infection has also been described, further supporting a role of the viral agent. So this was a question here in the comments as well, that if it is spike-based and virus could do it too, and here is that they're talking about, that virus, there are studies that also show that this can happen after the infection too. Pathways related to local changes in the endometrium, possibly resulting from spike-related immune responses or related to the endometrial expression of angiotensin-converting enzyme ACE2 receptors, may be involved. So this is the study, very interesting for me. My takeaway, the summary of this is that all ages of women, may they be in reproductive age but on IUDs or contraceptives, or perimenopausal, that is within a year of the menopausal age, and then postmenopausal, they all, with the messenger RNA vaccines, within 4 weeks to 8 to 9 months, they had unexpected higher risk of unexpected vaginal bleeding. 30% of postmenopausal had to seek medical, help as well, and the risk, the incidence, the risk of this incidence is actually, sorry, I shouldn't say that, hazard ratio was multiple times compared to unvaccinated. So that is a study. Thank you very much for tuning in. Please like, subscribe, and share. If you would like to support this work, there are links in the description. And the best thing is you can go become part of Dr. Bean Medical Lectures. With this, have a great weekend. I would see you tomorrow morning at 7 a.m. Pacific time for a morning walk. I usually put the link, the Zoom link. So we do a walk and we do a Zoom talk as well. I'll put that in the Discord. Thank you very much. See you again.